We are at the Sexual Medicine Society meeting in Las Vegas, 2015, talking with Ashley Tapscott of North Carolina. Ashley, you're dealing with a lot of erectile dysfunction, and we tend to think about the patient as being the principal customer, but with erectile dysfunction, there are really two people at the table. What's your approach? I mean, how relevant, and do you integrate the partner? What do you think?
Well, I advocate integration of the partner from even the first office visit to discuss the disease condition, the possible comorbidities associated with the disease condition, and what role the partner plays needs to be defined. I think that these patients oftentimes are depressed. They need another ear aside from their physician. Sometimes they have not even discussed a lot of their concerns with their partner, and I think that can create a lot of relationship discord, some distrust, some questioning, certainly of the partner's health. And I think erectile dysfunction specifically, as we know, is the first indicator of endothelial dysfunction. And I think partners need to be true advocates of their other partner's health. And I think that you have to have a partner that is willing to integrate themselves and participate in the process for the best successful outcome.
Do you find that the partners are open to this? Do they want to be included, or are you dragging them in?
No, absolutely not. I think they want to be included, and I welcome a partner at every single visit. So the first visit, I perform penile Dopplers in my office, and I think that, to me, is one of the most important partner visits because they get to see, is the erectile dysfunction a result of a filling problem, a storage problem, a little bit of both? They truly get to understand the science behind the problem that helps integrate them into the process and make them feel a total part of the solution.
So the partners like to be involved?
Absolutely, 100%. And I think the patient feels some great encouragement about partner involvement. I think it helps to just make the process much more pleasant and really, truly exciting for both the patient and their partner.
So one other thing. The world of erectile dysfunction, certainly surgical erectile dysfunction, penile implants and so on, it's a world of men. You're unusual. Okay, what's it like to be a female working in that world, both in terms of your colleagues, the other urologists, the other surgeons, and in terms of both the patients and their partners? Is it an advantage? Is it a disadvantage? How do they all receive you?
I think it's been a great, thorough advantage. Certainly my colleagues within the Sexual Medicine Society, other colleagues throughout the country that I've worked with, I think it's an incredible advantage. I think the true pearl of what I do is that I do have, in the heterosexual population, I have the partner's trust. The females can come in, the women can come in and speak to me about specific things that maybe a male physician might not ask them. And I think the bottom line of what we need to understand in our modern surgical era is it is the quality of the physician, not the gender, that matters. And I think you need to be in a qualified, advanced, expert arena in terms of selecting your surgeon. And I think that's what we're really looking for, whether that's male or female.
Great. Well, thank you very much for sharing your perspectives.
Absolutely. Thank you very much.